Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call him Meister Peisel. Meister Peisel has been a patient of mine since 2017. And since he had his hearing aids fitted, his ears block up with wax far more quicker than they have ever done before. And even the slightest blockage, like you're seeing in his ear, will make his hearing aids whistle and he can't hear so well from them then. So he's booked in every 6 months or so with me, sometimes even sooner, to have his earwax removed, so he can carry on wearing his hearing aids and hearing well. And he often says to me, "You know, Robina, of all of the 1,000 maladies the gods visit on us, hearing loss is the worst." And I couldn't agree with him more, that hearing is a really important sense. So I started the earwax removal procedure by trying to remove the little dead layers of skin around the periphery. And the main aim of this is to stop the blockage from becoming a full blockage and making it easier for Meister Peisel to hear with his hearing aids. So we're very, very gently going in without any oiling at this stage, trying to remove those dead, sloughed off skin layers, which will eventually attract more debris and become a blockage. Now I've oiled at this point because I felt the skin that's attached to the ear canal wall isn't coming off as easily as it should do, and it has made a difference. Can you see all there? The skin is actually peeling away quite nicely, and that's because it's been lubricated by the olive oil that we've used. Now when you have these sloughed off layers that are coming away, it can sometimes cause a horrible sound called clarinetting. So I'm always conscious of ensuring we don't get that during the procedure. And at this stage there was some clarinetting going on, which was okay for the patient. So we went in to the top of the ear canal. And even I'm surprised sometimes when I see the amount of skin that comes off. You can see the silvery layers just peeling away beautifully. And it seems to be never ending. But I went in with a fine tip at this stage here because the clarinetting was becoming quite loud for the patient. So these fine ends are a little bit like a silencer, just reducing that noise that the whole procedure produces. And the fine end has made it easier to pull away at those skin layers. You can see they're kind of disappearing into the tubing there, and there's a layer that's come off. So this is the final shot. You can see bits of skin around the periphery which hasn't come off yet, but the eardrum looks nice and healthy. So now we're going over to the other side, and you can see here that's a complete blockage. We can't see the eardrum at all like we could do on the other side. So we've gone in with the suction probe. And as usual, we're going in to find an area that will allow the whole blockage to come away as easily as possible. So again, we didn't start off with any oiling here because I felt it might actually come out without any oiling. So a little piece came away, now we're going back in and using the standard suction tube. We're trying to remove bit by bit the wax, and it is coming away. But I'm always quite gentle with Meister Picel because I want to make sure that I can get off all of those layers as much as possible. And bits of hair and a bit of a blockage came away there. So again, you can see lots and lots of sloughed off skin layers around the edge, coming away with the wax and the debris. And that's coming off quite nicely. And now we're going in on the other side. And again, a lot more skin has actually peeled away, ready to come off on that side. And the skin underneath is a little bit pinker because it's had the top layer removed. And I'm trying to gather it all into one place so that we get a lot of more suction due to a lot more material inside the suction probe. It seems to be working. Yep, it's come away, and that was quite nice to see. So there was a little bit just at the bottom that I wanted to remove. Again, we're not going to make this an ear canal where there's not one little bit of wax there. There's always going to be a little bit, especially since Meister Picel's skin is generally quite dry, which will be the same inside his ears as well. So we're just removing that bit. And there it's going into the tube. It's cleaning up that area there. Lovely. So that's the final shot of the left eardrum. Everything looks beautiful and clear there. And that's ready for a hearing aid to go back into. And thank you so much for watching. I'm really enjoying making these videos, and I really hope you're enjoying watching them too. For all of my regular viewers, you've probably noticed that I am sounding a little bit different because I am in a different location today recording this video, so that we make sure that you have your episode for this week. So hopefully things will be back to normal next week. Please do like, subscribe and comment. Let me know if you're watching these videos and where you're watching them from. And I will see you in the next one.